Happy Tuesday morning, everybody. Welcome to this week's episode of Tooth Teacher Tuesday with your host, Dr. Stephen Zahm. Today's topic is kind of an overview of a much broader topic with a lot of different rabbit holes we could go down in the future. But the overall question is, what exactly is a root canal? Root canal is probably a term that a lot of us have heard, even if not all of us have undergone one. Probably have heard a lot of bad things about root canals, but I feel like most things in dentistry get a bad rap. So just kind of give an overview of the topic and then maybe dive into some deeper topics in future videos. But essentially what a root canal is, anytime I talk with a patient about a root canal, I explain it like this: a root canal is essentially an attempt to resuscitate or save a dead or dying tooth. You can almost think of it like CPR for that particular tooth. And so what I mean by that is, if myself or any other dentist recommends a root canal, it's because that tooth is either super painful because of a cavity or some kind of break, or there could be any other number of reasons why we would do a root canal, but either that or the tooth is infected, you have infection in or around that tooth. And so at that point, anytime a tooth is infected, our options are either to try and save it with a root canal or to go ahead and remove the tooth. And so that's why I say it's a dead or dying tooth. It's kind of on its last leg, and a root canal is a predictable Hail Mary, but a Hail Mary nonetheless to try and save that tooth. And so, and like I said, this is a very broad topic. There are so many factors that go into the success of a root canal. They're very predictable, but a lot of factors depend on how much tooth is remaining, how much infection is there that's present, how compliant are you as a patient with your home care to maintain that tooth. So a lot of factors can affect it, and like I said, root canals tend to get a bad rap. A lot of people say, "Oh, I've heard those are really painful." Well, they're associated with pain, but that's because a lot of times when you're getting a root canal, that tooth is already causing you so much pain that really any pain associated with the root canal was there before we started. And by the time you're finished, you're in less pain than you were before the root canal. So it's kind of a chicken and egg situation, which came first. So, but not every tooth is a good candidate for a root canal. Again, a lot of factors go into making that determination. So even when a tooth's infected, sometimes the only option is to remove it. But if your dentist recommends it as an option, that means that there's a good chance of success. Otherwise, we wouldn't set you up for failure by recommending a root canal on a tooth that's already too far gone. But essentially the process of a root canal, without going into the nitty-gritty, this isn't intended as a high-level dental lecture, but I explain it to my patients like this. A root canal, essentially, we get access to the nerve of the tooth, to the inside of the root canal, where the nerves and the blood vessels to that tooth are in the middle of the tooth. We get in there and we take little instruments that almost look like tiny little pipe cleaners, and we just get in there and clean out the inside of that tooth, remove all of that dead or dying nerve tissue, and once it's all gone and disinfected, then we fill that canal in with a root filling material that seals it off, hopefully from any future infection. And that's essentially the process. A lot of other questions and topics spawn off of that, such as, will a root canal last forever? Do I need a crown after the root canal? And these are all topics that I plan on discussing in the future. But like I said, this is kind of a general overview of what a root canal is, and we'll get into more detailed questions in the future. In the meantime, hope everybody is doing well. Hope you have a great week. Hope you're in the holiday spirit. Obviously, we're all gearing up for the holidays, regardless of which holiday you choose to celebrate, but it's the most wonderful time of the year. So hope everybody's doing well, and we'll see you on next week's Tooth Teacher Tuesday.